Hi, this is the Dr. Deborah Show. This is the show where we talk about bringing peace and calm into your life. And later in the show, we're going to be talking about mental health stigma. We're live at KCSB FM. Actually, we're not live. This is pre-recorded at KCSB FM Santa Barbara 91.9. KCSB is a platform for cultural expression and thoughtful discussion, providing a diverse educational forum. And I'm a Santa Barbara-based clinical psychologist, and I specialize in pediatric neuropsychology. And during my clinical training and my current work, I've treated thousands of people, and I want to share this information with you. I'm also a UCSB alumni, and I live locally in Santa Barbara. So this show is all about our community and how to create compassionate conversations about our well-being and health. And today on the show, we are talking about mental health and well-being with a focus on pediatrics and children's health with our very special guest, Dr. Ben Meisel. Dr. Ben Meisel is dedicated to improving the lives of children with special health needs, and he does this as a physician, musician, and social entrepreneur. Currently, Dr. Ben serves as the medical director of California Children's Services for the city and county of San Francisco, and he's also a social entrepreneur who founded the social enterprise called Dr. Ben and Company, and this develops products and programs designed to support the field of child life and benefit nonprofit organizations. It's called Building Play into Health for kids with life-complicating medical conditions and their families. Dr. Ben is also known internationally as a children's music songwriter and performer. Dr. Ben is a member of the National Academy of Recording Artists. And his most recent camp-inspired children's music project titled A Perfect Day was released in partnership with the SeriousFun Children's Network. I want to hear more about that. Shane's Inspiration and HopeLab. Dr. Ben's approach to improving health for children relies upon the power of play as an essential component of pediatric medical care, and he feels most comfortable serving as an ambassador, bringing together like-minded organizations, individuals, and causes to benefit children, teens, and families who live with the realities of serious medical conditions. And also, Dr. Ben has been the chief medical advisor and medical director of the Painted Turtle through California's SeriousFun Children's Network medical camp created by actors Paul Newman and Paige Adler. And finally, over the past decade, Dr. Ben has worked extensively with 15 partner children's hospitals, I love that, in California to provide medical camp experiences for children with chronic and serious medical conditions. So I want to welcome you to the show, Ben.
Thank you so much, Deborah. Good morning.
Good morning. And we're talking, Ben is, based more in San Francisco, and I'm so happy to have you on the show. I think this is a really important topic, and I love all the work you're doing. So thank you for coming on this morning.
Thank you. It's an honor to be talking with you.
Yeah, it'll be fun. And I usually just at the beginning, I like to just talk a little bit about mental health stigma for people who are listening who maybe, don't know what mental health stigma is or why I'm even talking about it. But we're here talking about mental health stigma today because did you know that mental health is the largest public health priority and the largest financial burden of any health issue in the world, according to the World Health Organization and World Economic Forum? The Centers for Disease Control report, in a report called Attitudes Towards Mental Illness, found that stigma and embarrassment are two of the top reasons why people with mental health issues do not seek help or medication. And I always just like to reinforce the idea that issues of mental health surround all of us from all walks of life. And I just also like to talk a little bit about what is mental health. I think mental health is a physiological balance where our heart's beating at a nice rate, our nervous system feels calm, our tummy feels relaxed, our thoughts can be more clear, and this gives us kind of a sense of inner peace, to put it simply. So the Centers for Disease Control and Prevention say that mental disorders among children are described as serious changes in the way children typically learn, behave, or handle their emotions, and this causes distress and problems getting through their day. So early diagnosis and appropriate services for children and their families can make a really huge difference in the lives of children with mental disorders. And then having access to providers who can offer services including screening, referrals, and treatment really varies by location. So that's why I wanted to have Dr. Meisel, because I know he's been at lots of different locations and deals with lots of different people. I was wondering, Dr. Meisel, how would you describe mental health?
That's a great question. Go ahead and call me Dr. Ben.
Dr. Ben, sure.
Yeah, no, just because I think one of the challenges for me being a physician is really the hierarchy that kind of sets up between people. In one way, it provides a lot of respect towards me, but I think one of the challenges in our society, in some ways, is that we need to really see one another, and in order to do that, we have to climb down off of our hierarchies in order to do that.
For sure.
So when I think about mental health and what that is, I think about the sense of wellness and finding wellness, and how do we do that. In my experience working with children with chronic medical conditions at camps, I think that is where I've come up with a lot of my own understanding of where wellness can be found even within the context of illnesses. And today, I think it's harder than ever to create villages, even though there are tools for us to connect with one another technologically, but face to face, I think, is something that we seek as social beings, and it's become more and more difficult given that that we're dedicating more and more of our time on devices.
So true.
And so when I think of wellness, and I think about the context of chronic illness or chronic mental illness, I think chronic illness and even the illnesses that we make up in our own heads that become real to us, they can wreak havoc on our ability to function, see possibility, and move forward despite our ongoing stressors. And we need other people to help us. Also, to help us pull out of that.
It's so true. I love that you're pointing that out. I mean, I know my research too focused more on, like, if you think of mirror neurons, we need that to develop too. Just right, developmentally, we need to look at other people because we get that information, that feedback, and that helps us to grow and develop in a healthy way.
Absolutely.
So you're
you said something else. Sorry, I'm talking a lot.
No, you're perfect.
You said a lot of things that made me think. And one thing that you talked about is how important it is to get support for mental well-being from others. And I just feel that at this point, I mean, there's a huge opportunity for us not only to fund this better, but for there to be more providers, more people who are trained to listen to one another and be present. And each of us can do that in our own lives for the people that are around us.
It's so true. I know I try to reinforce the fact that you don't have to be a therapist to be a good listener. And even, when I talk to people who are suicidal, whatever age they are, I mean, we may not have the exact words or answers, but sometimes just having somebody who's there listening to us and has a caring, even just looking at us and showing that they care can really make a big change. But I think that it's just such a huge issue now that we're all going to kind of have to learn. Like even in my practice, I try to teach people to kind of become like mini psychologists so they can learn and get educated.
That's fantastic. I mean, just to be able to have that relationship with a patient, but then it becomes, their experience of challenge. If they can rise out of that with some help, they can then be an advocate and be, even more helpful to someone who is going through, possibly something similar to what they had to deal with.
Right, exactly. I mean, we're all going through different things. And I love the idea that you call yourself Dr. Ben, and maybe we could just back up to that idea because I was thinking how I agree with you completely. I mean, even as myself as a doctor, people come in and they ask me what to call me, and I just usually say whatever you feel comfortable with. I mean, I think that there is a stigma even in the idea of the hierarchy of a doctor, the power difference. But I mean, I was trained by James Hillman, who, took over Carl Jung's Institute. He used to come here. And I remember
yeah.
him, he'd have physicians and psychologists, and he'd say, really, it's not a power difference like you're sitting in this big chair and you know more. It's really a collaborative relationship with your patient, to follow their journey and kind of learn from them and it's a relationship you're building. But how do you think that physicians could, I love that you're doing that. How did you get to that epiphany, and then how did you implement that? Or were you naturally more just doing that along the way of having this kind of openness with your patients and families that you work with?
There's, I've always wanted to work with kids. Like even when I was a kid, I was like, I want to work with kids,
I'm like that too. Yeah. Mm-hmm.
It was always part of my, just who I was. And I think, early on in my life, I loved people. My parents brought people into our home. It didn't matter, what walk of life people were from. It was really just if they connected with them personally in some way, they were invited to our house for dinners. And my mom would, she was an experimental chef, so she would cook all kinds of crazy things, and people would come to explore her foods with us. And it was,
Fun.
It would be the garbage man and the mailman and so my dad was a physician in rehabilitation. He started the Rehabilitation Institute, which is now the Cottage Rehabilitation Hospital in Santa Barbara, and so there would be just a real variety of people coming to our home, and I always admired that and felt that was normal to have a whole community of people and to feel safe with even people that you don't know. And I think that sense of safety was something that helped me a great deal growing up, to feel possibility in the world. And when I went to start working at camps for these kids who were coming from all over the world, and what they had in common was a sense of isolation, a sense of chronic illness, and to be able to help them find a way to connect with one another. It doesn't happen naturally when you have a whole bunch of people who are afraid, who feel that there's instability in the future, that things are unknown. And people can attack one another or put up walls to keep them from connecting. And there was the magic of the SeriousSFun Children's Network and of the camps that Paul Newman created, and the people that were put in place in order to develop some of the rules around camp, and how to invite strangers together to live in close proximity and then get along. There's really a sense of how do you create stability? How do you create a sense of safety in an environment? And there were different camps word it in different ways. I like to talk about it as the STAR model, STAR, and one is so the S stands for stay safe, or create a sense of safety. The things that you're going to be doing in this week, make sure that it keeps yourself and the other people around you safe. And then T would be try new things. So go out of your comfort zone, and push your boundaries, but also stay safe at the same time, right? A stands for always build up. So the idea that not only are you, that statement that if you can't say anything nice, don't say anything at all. Well, this is like a step further. This is actually say nice things about other people, right? Always build up. And that
which
also,
I think we're not taught to do. We're taught it's kind of like what you were talking about with your growing up and meeting all these people of different walks of life that, were just new to your world, and just learning that acceptance. Yeah, I think we have an initial kind of rejection of others and ourselves. It's true.
Yeah. So that always build up, that's sort of like, put that tendency to want to bring someone else down, put that in check. And then R stands for respect yourself, others, and the environment. But it's really, some of the kids, they end up signing sort of a covenant to each other when they're inside of their cabins, where they add to this list. And some of the things they might say, don't touch my stuff.
They personalize it. Mm-hmm.
Yeah. Then it becomes personalized, and they sign off on it. And you can always go back to that list and say, you have each other sort of monitoring the group's behavior. So, like if somebody steps out of line, you now have this set of rules that you can go to, and you're not like pointing at the person. You're saying, hey, remember, this is what we're living up to here. And so I think that is something that really struck me, trying to figure out why is it that all of these kids from very different backgrounds are able to come away from this experience at these camps a completely changed person, with a sense of hope, with a sense of being able to get through traumatic experiences more than they were when they first came to camp.
Well, also there's a real acceptance. I mean, I think it sounds like the camp has no stigma, because I think that there's like the social stigma and self-stigma, where when we're in social groups and we feel, the attitudes or discriminating behavior that's directed at, an individual, then the person can take that on. And then also that self-stigma, where someone internalizes that perception of discrimination. So it sounds like this gives them some tools so they can kind of not feel so ashamed, and also have better treatment outcomes.
Yeah. And it's a universal set of rules that, they can take with them, if they're feeling brave enough to sort of lay it out for everyone else. Hey, this is how I function in my universe, and to be able to say, to be able to avoid those people who are just not willing to sort of follow those kinds of rules, like to identify them as, maybe they're not the healthiest kind of person.
Right. What I try to teach people is not as much avoidance, but I try to teach them to be aware of that and then not engage. Not engage is the word. Because I think when we feel like we can't, we get fear-based, So I think, how do we create space when we have bitter things in our life, and that's really hard to do physically and mentally. But it sounds like what's happening there is people are the kids, and also maybe, the people who are working with the kids are able to take better care of their mental health, by being able to discuss their emotions and their thoughts and their feelings within themselves, with each other and with other adults, right?
And it's a really interesting group of kids, because these are often rare conditions, and they've, for the longest time, felt like they're the only ones, and then they show up and all of a sudden there are 120 kids, all kids with kidney failure on dialysis, or that they never realized, wow, I have a future. And look, they're older kids who are actually going to high school and being people and having fun, and so
big impact.
That has a huge impact when you've been used to feeling isolated and alone.
Well, yeah, I think isolation too for mental health is really the crux of when you get to the place where you're really, some people need to retreat and regroup. I think that's very healthy, but also what happens is some people retreat and then they continue to retreat and they kind of shrink away to the world around them, and it's hard to get that bridge going. That's why I like radio too. Maybe someone's listening and maybe we touch them that way, and maybe there's someone listening who has a child who has, a serious mental condition. And maybe they they hear, oh, I'm not so isolated. There's some hope. There's some resources.
Absolutely.
I was doing a little research because I like to look up current, news and research that's going on related to what I'm talking about. And there was something I found that was it was an article. It was a journal article, and it was about behavioral health integration in pediatric primary care. And then it was called Considerations and Opportunities for Policymakers, Planners, and Providers. And what I thought it was just, it said nearly 1 in 7 children ages 2 to 8 in the U.S., and I would guess maybe that's not even accurate, because that was from 2017, has a mental, behavioral, or developmental disorder. And then among children and adolescents aged 9 to 17, as many as 1 in 5 may have a diagnosable psychiatric disorder. And then they were talking about how not a single state in the country has an adequate supply of child psychiatrists. And, we're just at this huge shortage, even though there's
Mm-hmm.
models that exist for treating these children effectively, like in primary care settings that offer this integrated family centered care. And I hear you're dealing with, even further down the road with these more intense, complex cases. But I mean, I did look up, I know your history, where you've worked with lots of different scenarios with children.
Mm-hmm.
I was curious, how do you think mental health and the pediatrics or children's health kind of intersect?
It's there are so many ways to talk about that, and I think we have become more and more specialized, especially um, as primary care providers within a for-profit health system. It becomes difficult to spend the time, right? I mean,
Yep.
you can sprinkle mental health support throughout every visit a little bit, and that's, I think, a lot of pediatricians aim for that. But when you're having to see someone every 10 minutes, there's and when people come in and they have lots of questions and you actually have an agenda
Right.
that you need to fulfill, when they come in for a well care visit, or they come in for an illness visit, it's very difficult to do the work of pulling the parents
Oh, it
aside
takes a lot
from
of
the
time.
child, and
Mm-hmm.
yeah, it's challenging. Um, so I think what we've I think what I see happening a little bit more is that there are more and more specialized pieces that are available to pediatricians who are within a system. Let's say Kaiser, for example. I think at least up here in Northern California, Kaiser has done kind of a remarkable job around making specialty providers available to the primary care providers as the primary care providers see it as important, for quick intervention. However, really, it needs to be. I mean, I wish it was more. I wish it was easier for a mental health intervention to happen between the pediatrician and the patient right away when it's happening, to be able to just say, "Ooh, we need space here. We
Exactly. Well,
need we need a way to create some space and to have more time between me and the parents, or me and the caregiver, as well as the patient, to try and figure out what really is going on, what led up to this child feeling the way they feel right now. That takes
time.
time.
Oh, I know. It does. I mean, my
Yeah,
dad is a physician as well. And it's like, I mean, half of his time as an infectious disease internal medicine doctor was spent talking to people. And I also
yeah,
think you get a better, actually, assessment of the person's situation by listening to them.
yeah.
And in the future, maybe it wouldn't take as much time. But I hear what you're saying is that you're really packed in there and you have too many cases, maybe because of the burden. And then you have this, at like Kaiser, they have a kind of bridge of referral. I was looking up the American Academy of Pediatrics has this new mental health initiative. It's called the
Hmm.
AAP Mental Health Leadership Work Group.
Hmm.
And it's kind of cool because they've developed a set of teaching materials on brief interventions and then managing mild to moderate anxiety. And then they're
Mm.
hoping to begin a larger set of materials that will help address other common mental health issues in the primary care setting. Because, I mean, I think the need for primary care clinicians to manage children with mental health concerns will really only continue to increase in the future. And so they're
Mm.
feeling that primary care clinicians are and will continue to be maybe the first important resource for parents who are worried about their child's behavioral problems.
Hmm.
So I thought,
I,
have you heard of that?
I mean, so I haven't actually looked into the AAP's new mental health tools and
You sound like you're doing them
recommendations, but
already. So,
but yeah, well, I mean, some of what I do, I'm not seeing primary care right now. When I'm with patients now, it's more in physical and occupational therapy settings for children with musculoskeletal conditions, just because that's part of what we do in California Children's Services. But I'm constantly trying to connect um, kids and their families to resources that can help them build resilience from and community. Um, And so, when I think of more specialization of providing mental health resources in the community up here in San Francisco, we have the UCSF Osher Center for Integrative Medicine, and there's a physician up here, Dr. Brittany Blockman, who has started a program called Communitas, and it's for preteens and teenagers who have chronic medical, like physical medical health conditions, to be able to come together and become a support community for one another. And there's also a parent group that has to happen at the same time. And these types of programs where you actually are carving out the time that's necessary and connecting kids around identifying with one another, but then empowering each other to become advocates for other people who are like them. And it's just I think people's eyes are opening to these types of interventions more and more in
having more interventions and more monitoring.
In conventional medicine environments like UCSF. I mean, I think that's brilliant, and I would like to see this happening more and more. But what you say in primary care offices, it would be one thing that I did a long time ago, as I think it was after I had started working at the camps, was the power of self-hypnosis. I thought was very effective in certain kids in helping them handle their anxieties and their worries. And so the Society for Behavioral and Developmental Pediatrics was offering trainings on how to teach self-hypnosis to children. And so I went and did one of these, actually did it for about 3 years, and was able to, in these short visits, I was able to set up a visit with a patient and say, hey, let's set up a visit just to do, so you can learn self-hypnosis. And so for a number of kids with asthma, kids with anxiety, and as many other kids as I could, we would set about 10 minutes apart just so that they could learn some of these techniques, and then we would review it over a period of weeks, in addition to doing some primary care at the same time.
That's cool. So they're kind of learning their own self-care skills too. Have you ever tried mindfulness meditation? I know hypnosis can be really powerful. I was just thinking they're different but similar.
Yes, absolutely. I think mindfulness is sort of a first step towards self-hypnosis. It's very much they're integrated to
the awareness.
They're similar. They're similar, and mindfulness is just such a powerful thing in that you can be doing it and nobody would have any idea that you're practicing this at any given time, and it's just such a centering activity that can enable you to feel safe wherever you are.
Exactly. That's why I love it, because it doesn't cost anything. You can do it anywhere, and it's really such a beautiful gift for yourself. And then usually we're better for the people around us. But it sounds like, in a way, the people that you're especially working with now, the children and the families that have more severe medical conditions, in a way kind of have been stigmatized because they've been maybe feeling like self-stigma, like labeled, through isolation or negative attitudes or misinformation. And then from a lack of understanding about a behavior someone might, or an appearance or of communication, and then someone labels them as not normal, and then that leads to further rejection and an increase of mental health conditions. And then I don't know, but it sounds like you're swinging it the other way. So you're not rejecting them, and then they're reducing their mental health conditions, and probably maybe that improves their health too.
Yeah, I'm thinking about being a member of their community, and they're a member of my community, and just there's a sense of inclusiveness,
totally,
right? That we have to live our lives acting upon, so that inclusiveness is something that we feel for each other. And then I want to say something that I think is really relevant around resilience. And I had a I had a teacher in medical school named Dr. Ken Ginsberg, and Dr. Ken is an expert on resilience. And one of the things that, if you look at social psychologists, sociologists, and behavioralists, when they're trying to figure out, what do kids who are put in very traumatic situations or are highest at risk for for
mental health
falling,
condition.
from mental health challenges as a result of the trauma they've experienced.
Right.
Those kids who are able to actually get through that, move through it, like what is it that they have in common? And one thing that they've been able to pull out is that if you have an adult in your life who will not leave you and who will hold you to high standards, those kids who have that in their lives are able to pull through their situations more often than those who don't have that. And so one of the important parts of us as we're putting together programs to help the kids that I serve is, finding out, first of all, do they have an adult like that in their lives? And if not, can we help them to identify one so that they can build that relationship?
Yeah, that's true. Oh, well, when I worked at the county, I used to just instead of hospitalizing someone, 5150 them, I would spend like all afternoon kind of opening up my phone book and calling whatever department I could find or people, and also checking out, like you're talking about, what friends and family they have, because it is huge. If you have someone in your life, it doesn't have to be a family or friend, but just somebody else who will listen.
It could be it could be the pediatrician.
Sure.
So trying to build that relationship with the patients, if we can have more physicians be able to build that type of a relationship
right.
with their patient. I mean, I think of there's a great doctor in town in Santa Barbara named Dr. Christopher Elsner.
Yes, I know Dr. Elsner.
You know Dr.
I
Chris?
do. Actually, we were going to do a meditation group together, and then he moved to the Valley, and but I know him. Yeah.
So so he has he is of similar mind here, how to build a community for kids at risk,
right.
and for all of the kids that he serves. He started developing an arts group for youth in Santa Barbara, and I think up in San Ynez, where kids who have maybe are having trouble in school but have a propensity to art, that this is a way that he can get them to focus some of their creative energies and meet other people who are like them, and then do activities that are constructive in order to help them overcome some of the.
Well, and I think what you're mostly talking about that is an overarching theme in your practice and the way you approach your patients is this collaborative relationship building and also diffusing this power differential. I know with my patients, like I was saying about what they call me, but also the first thing I usually tell them is that we're building a relationship. So when they leave, I still care about them. It doesn't mean we may not see each other for a week or however long, but I still am thinking about them. And if they need me, I'm here for them, because I think that
Wonderful.
gives people some security. Thank you. And I love that you've kind of diffused that, so there's like an openness where kids and families can feel more comfortable. What do you think that your work in the pediatric children's health field has taught you about the attitudes held toward mental health, just in general? I mean, I know you've surrounded yourself with a group of people and people who are like-minded. Do you think that's moving? And I hear maybe it's moving in that direction. Do you think when you think past all the experiences you've had, how do you think people just look at mental health? I mean, because I know it's been an overlooked issue.
Yeah. It's, I think we're at the point where there's a crisis to the extent that people are taking notice that there's a lack of these services, and it's not easy to immediately implement something, right? It's going to take a lot of work and a lot of vision and a lot of money, in order to build a system that is, safe, that adds stability to our mental health, to all of us. And so, it's difficult right now to think. I mean, I think I'm very encouraged by things like the governor's new budget. When you look at Governor Newsom, he's sort of come in, with that, with an interest in mental health and throwing money where it may help build more mental health services, especially for children.
Yep. Well, it's true. I think that that's human nature. We wait till everything's kind of really at the, the tip,
Yeah.
because I have this minor in global peace and security I got here at UCSB, and it's like one of the things we learned about negotiation, any kind of conflict resolution is that people they tend to wait till it's like really intense. I was always taught by my dad, as a physician too, just more preventative medicine, front load it instead of like backpedaling. I feel like we're in a culture, especially in America, where we're backpedaling a lot. So I'm always trying to set down some foundations and also stimulate conversations about, what we could do to refine that. So I think it's kind of a collaborative effort. Yeah, and I think that we are kind of in a state of crisis because there's just, they say that I think 21% of U.S. children and adolescents meet the diagnostic criteria for mental health or substance abuse disorder with, very impaired functioning, but only 20% or so are receiving that. And I think that's not even, I think it's a lower number than that. So, I mean, what do you think about the idea also of how do you think people could collaborate, like with the schools and the teachers and the, the counseling agencies and the doctor, everybody? How do you think that could happen? It's a big question. I know they threw in there. That was a new one.
Oh man. I mean, I just, let me
Mull that
talk
over.
around. Oh, go ahead.
Okay. No, that's okay.
Are you okay?
Yeah.
Okay.
I wasn't sure if that was too big of a question.
Oh yeah. Let me talk around this a little bit.
Sure.
Because I think, we're in a place of crisis for a number of reasons. Not only is it because there's a great need for mental health support that doesn't exist right now. At the same point, I think a lot of, in the past, there was research dollars and there was at the NIH that there was a real emphasis on really looking, doing serious research that is unbiased and not being funded by companies that could bias the research. So they've decreased the budgets for that type of research, and there's a real sort of movement around taking away the ability of researchers to stay unbiased that way. People are having to go out and get research funds from for-profit companies that have an agenda. So like we're in a difficult place because of that also. Like, how do we work through, how do we support our researchers who really don't have any agenda except to come to the correct answer? There are lots of people like that and who are starting out their careers who want to do that. Now we need to make that type of research funding available to them. So I think that's one piece that I think is currently making things difficult. Another part, I think the elephant in the room is really the fact that we're spending so much time on smartphones and on devices. And for kids, that's especially dangerous when it comes to mental health. A major reason is, I've heard several researchers who are researching technology and the effects of technology on mental health, that in the frontal cortex, where we have our reward centers, by stimulating ourselves. So, when we use Skype, when we use Facebook, when we're looking at the news, when we're looking at our email on our smart devices, these are all gamified. They're made to provide us with little sounds and little images that tell us little clicks and things that feel satisfying to our our frontal cortex reward center. And for children, our our um, our nerves in the frontal cortex, they don't complete myelination until our mid
12.
20s.
Oh, is it
And so,
20s? Okay, yeah.
yeah, it's our mid 20s. They say, they say roughly by the age of 25 or 26, you
Which
finally
makes so
have,
much sense, because when you're in your
yeah,
20s, you really are figuring out a lot of things. I work with a lot of young adults, and people have this misnomer that you should have it all together, but your brain is still developing. So that's a great point.
yeah.
I'm listening. Sorry.
No, that's okay. Yeah. So when we're playing all of these very stimulating games or using these stimulating apps, what ends up happening is our frontal cortex, it downregulates a lot of the receptors for um, for the opiates that we naturally produce, and for these stimulating hormones that we have going on. And when we downregulate these neurons, we then go seeking more and more and more of this stimulation, and in order to get back up to that experience.
Well, it's very
And
chemical too, because we get
yeah,
dopamine release every time, and it's just like a drug. So if it
there it
feels
is.
good, people, and then they get a little adrenaline rush, and yeah, like you said, all the dinging and swiping, and even I watched on 60 Minutes, the guy who created that, he wishes that he never had done it in a way because he knew it would get people addicted, but it
Yeah.
was obviously, like you're saying, it's not just a phone in your hand. You have to really think about how it's impacting your chemicals in your brain structures, your development, your mental health, all these pieces.
So if you've got all that stimulation and then it falls away for some reason,
Right.
then we have this real sense of depression and loss that we can't explain. It's like, why do I feel like this? It's really because we're away from the thing we're addicted to. And for kids, and if they've downregulated this part of their brain, and you're much more at risk of that happening. If you're downregulating all these things, you're not making the neurons
Right.
that you need, so that once you're fully myelinated after, in your late 20s and the rest of your life, um, you just have less ability to have these highs, especially around connecting with other people. So,
Well, it sets our kind of thermostat. I usually talk a little bit about how we're kind of all wired a
yeah,
little differently. And I think some people, they are born a little luckier. Maybe they can regulate their system. But I think that, you have to we have to be honest with ourselves about how our devices are impacting us. And I'm kind of a cowgirl. I grew up in San Luis Obispo. So for me, I grew up watching the clouds and playing with grass and riding horses because that's what I did. So
oh, you lucky, you're so
I
lucky.
feel very
That's
thankful.
wonderful.
Well,
Yeah,
and it's a great template for me. And so when I get on my device and I'm not an addictive type person, but I let myself do that. I wanted to see how I could get addicted and unaddicted. And it's
yeah.
very fascinating. It becomes a very automatic conditioned response. But what you're saying is that, how much it impacts the development of our brain structures too. Um,
Correct. Yeah.
so I know you have this really trusting relationship that you've built with children and families. Do you talk to them about the risks and concerns and those symptoms as they arise, or?
Absolutely. I mean, I try to be proactive, like,
Yeah.
to talk about. I mean, we have to use the phones and the iPads and all those things, because they are fantastic tools in lots of different ways. But if we get trapped by our tools, it's just like trying to um, moderate. It's like anything in moderation can be okay. So
Mm-hmm.
I do think it's important for all providers of healthcare, as much as they can learn about this, to help help their patients prevent this from happening, from it helping them have vacations from their phones, or for kids,
Mm-hmm.
making sure that they're not in their rooms at nighttime, because there are other people who are going to be calling them in the middle of the night. And if this becomes a habit, I mean, this ends up being an addiction that can really,
Oh, I know. Some kids
really damage their sleep and damage their relationships with other people, because during the day maybe they're not as alert because they've been on their phone at nighttime.
I especially think young adults, even, that are in college and stuff, that maybe are listening to our show, will relate with this because I know my practice. I mean, the young adults I see, they're very, they break up, they create relationships. Everything's done over the phone.
Right.
I was looking up some other news, and it was talking about how mental health care really is becoming more mainstream in pediatrics, and like primary care clinicians, if they're trained and supported, they're really in an ideal position to identify the children with mental health problems and then to triage, for emergencies, initiate care, and then collaborate with like mental health specialists to facilitate this higher level of care when it's needed. It sounds like what you it says the American Academy of Pediatrics is urging primary care clinicians to expand their comfort and skills in diagnosing and managing or co-managing, which I love the idea of, children with common disorders, including like at a minimum like ADHD, anxiety disorders, depression, those kinds of things. It sounds like you're already kind of doing that. When you get together with a group of pediatricians, do you think everybody's on board with that, or are people opposed to that, or they just aren't doing it or are doing it?
I would say the majority of pediatricians are definitely on board around, especially co-management, just because there's so few mental health providers out there that can manage medicine when the kids actually need medication. And so I think there's a role around actually prescribing the medicine when that's necessary, or working together with a therapist when you have a relationship with therapists in the community. I think the hard part is that when you're in the office and you're seeing people so quickly, often the mental health support community and the pediatric community, they don't have the chance to intermingle and
That's
connect.
what I would love. I know that's what I was kind of getting at. How do you think we could make that happen more?
That's a great question. I would say to have a combined meeting, like having. I would if I were you, I would make an appointment with the head of the Department of Public Health or Maternal Child Adolescent Health Division in Santa Barbara and say, hey, let's get pediatricians and mental health people together to talk about how we can commingle and create a network, even like a bat phone for being able to connect when we need to.
Maybe you could come and help us facilitate that. I guess I feel like it needs to be nationally. But it's good to start local with grassroots ideas, but I just feel so strongly. I think that now there's more even pediatric facilities that are, being built to gear towards adolescents, to the behavioral health. But I just feel like people are kind of not open to talking about it as much. So it's like the silent killer, because I think it's so hard to come to terms with the idea that, particularly among children and adolescents, that it's about 75% of mental health issues manifest before age 24. And then, if they're left unaddressed, this can have a significant downstream effect on our healthcare system and our society. And so I guess back to the idea of preventative medicine and catching that earlier. I know that they did, like you're talking about, that they've expected to spend $280.5 billion in 2020 for mental health and substance abuse treatment. That's from the Substance Abuse and Mental Health Services Administration. I don't know if you've heard of that. But like you're talking about, America's youth, we're not forming strong relationships that can help us get them through the tough times. And then if you pair that with, someone's has a medical crisis, or they have an addiction, or something's going on at their home, or socioeconomic issues, the stress is just so big for these, for the children that are coming through up. Have you heard
for the families, I just think that there's it's shame, embarrassment, like you said, people aren't talking about it. I think right now there's so much division going on in our country that it's just overwhelming, and we're feeling fear, and we're feeling separate from our neighbors, and this just leads to less and less talking about things that are uncomfortable, and people pulling in.
It's true.
And so I think when you say people aren't talking about it, I think that people probably want to,
Right, they
but
do.
it's just there are a lot of overwhelmed people right now.
That's
It's a
why I'm doing
challenging
this
time.
radio. That's why I'm doing this show, because I mean, I have the thousands and thousands of people I've talked to. There's not one person who has said, gosh, I just would love to be able to talk to someone about this. And, and also it makes it feel more normal, quote unquote, normal to,
Yeah.
and I always assure them they're not alone. There's, many people have the same issues. And I guess I have this idea, of maybe having people just in a very simple way. I think writing things down sometimes helps. Signing, something, committing, like, I'm going to be more transparent about my mental health, whatever profession they're in, and I'm going to talk more about mental health. Like if I'm, a teacher, I'm a fireman, or I work in a liquor store, or I work at the post office, just to get that conversation going, to open the door,
Mm-hmm.
so to speak. Because I think people then would feel more, just better. I think it would help them not feel so stigmatized too, and that would help them feel better. Do you have you ever heard of any campaigns or like organizations in the pediatric or children's health programs that work toward specifically reducing mental health stigma?
That is a really good question. Let me
Thank
think
you.
about that.
I like to ask people that, just whatever their profession is, because I just love the idea of, it doesn't have to be complicated, but you know what I mean? Just some simple campaign that, or, in Europe they're doing that, or an organization that's focus is, let's reduce mental health stigma for children, whatever is going on in their life, so that they can feel open. And, I think kids nowadays too, they're taught not to talk about their feelings in some ways, because like you're saying, we're all living in this fear-based place. So I just wonder, where is a space for them, and then they jump to the phone, and then they jump to this event or this sports
Mm-hmm.
activity. I mean, it's like,
Mm-hmm.
it's kind of, you get cornered.
Mm-hmm.
And I also just feel that the media is such a great way, because I mean, I don't have TV in my home. I mean, I raised our son without TV because I just think there's other things, but I also think people do listen to TV, and how could we maybe have a
Yeah.
campaign or some organization that people
Mm-hmm.
could feel comfortable with and listen to?
I mean, I what one of the suicide awareness. I think that has been a really great conversation starter,
Mm-hmm.
that I've seen as a big campaign um, uh, recently. And when I think of mental health and a sense of wellness within schools, I think there have been some pretty big campaigns around bullying.
Right.
So there's been a lot of talk around that, which I think at its core is about um, is about mental wellness, and how do you create that in a community where you have to be every day as a kid.
Exactly.
So
I agree
so
completely.
I think I'm hearing school districts, talking more around that. How do we? There's an organization called PACER, PACER. They're out of Minneapolis, Minnesota, and they created the National Bullying Prevention Center. And there are so many resources on their website. It's all free to the public, and they have a brand new curriculum called All In,
Yeah.
and the All In curriculum is something that a school can do for a year in order to build community for everyone, and create an inclusive environment where safety can happen. And I think that's when I'm thinking of um, what do we need to do right now, given that we're on this train that's going too fast, and how do we get off of it? Uh, I think being aware that these phones, these devices, these things that we're using, these tools we have that are so amazing, but they're keeping us from being fully present with one another. And I
Mm-hmm.
think that is a critical piece that each of us needs from one another, especially when we have uh, a sense of urgency and we're not feeling mentally well. We need someone to get off of that train and be fully present with us. So when you say you don't have TV in your home, I think that's absolutely wonderful, and it's unusual.
Well,
I think that,
I have started, we have an IMAX, so we got Hulu like in the last year or two because I
yeah,
finished all my
yeah,
board exams. I thought, okay, we'll watch a little TV, but I
yeah,
really don't turn to the TV. I've been kind of more conditioned, but I think like my son who's 12, he's definitely more because that's what they do in the schools and everywhere, his friends. I mean,
sure,
I guess I keep thinking of the Dalai Lama, and he says that we're all breathing in the same air, and this thing about dividing and that we're separate. I mean, it's an illusion. We're all here together, and we all
yeah.
have to work together and not have an illusion that we're like better, separate. Um, and I was curious too, like, I mean, I know we just have a couple more minutes, and I'm really enjoying this because I think you've got some really solid approaches and ideas and ways that you're working currently, and then you have really wonderful ideas for the future too. How do you think that? How do you think we could put more pediatrics or children's health into our lives in a simple way that would help create more mental health? Do you have any tips for
Sorry,
anybody?
hold on.
It's
My
okay.
Japanese clock
No
is going
problem.
off. It goes off every hour with a different
Sure.
song.
That's
Yeah.
okay. We'll listen to it for a moment.
Yeah, sure. Here you go. This is this is the clock that was in a clinic I worked in Tokyo. I
Oh,
was I did a medical exchange in Tokyo, and when I left, I mean, I made the mistake of telling them I loved the clock, and they snuck it into my bags. And when I got back to the United States, I opened my bags, and there it was. And so I've had it in my offices ever since, and
awesome. I love
it
that.
keeps me smiling at least on the hour.
Do you think in Tokyo, do you think that they have the same? I know. I remember when I go to the dentist, they have those cat clock, with the tail and the eyes. I love clocks. Do you think in Tokyo they have the same mental health things going on with the kids, or no? Is
Whoops,
that a completely different?
you just
I
you
cut out.
just you just disappeared. I don't
Okay,
know. Okay,
sorry. I was just
are
asking
you?
in Tokyo if you think like that's
Oh, oh,
similar to America or just
oh. I think actually mental illness in Tokyo is it's great to actually, as a mental health person, I highly recommend you go there just so that you can see the contrast. At least in the United States, we're attempting to directly deal with
right.
mental illness.
Yep.
In Tokyo, in Japan, there's a stigma for the doctors to even talk
The shame
about
is so
mental illness.
huge. Yeah.
It is, and there's a sense that if you talk about it, it will become real.
I know it's
So,
like suicide. Well, that's why I tell people, I say, by talking more about suicide, you're not going to become more suicidal. It's the opposite. So it's the same
yeah,
thing, for mental health. We're both letting as doctors and people who have been around a lot of people, that it's not going to make you have something by talking about it. It's going to actually, what the theories now and what I tell my patients is really to try to welcome the things that we're most afraid of. If, like you said at the beginning of our conversation, these are opportunities really for growth and evolution. But I think we're just taught, oh, I don't want to face that or I don't want to deal with that. But I think we need to create more conversations and also a culture, that are more accepting of each person as we work toward prevention. But we need to do this by starting to treat all people equal and then reduce this discrimination that we have.
yeah, the
Um,
more able we are to talk about these things, the safer an environment we're creating for everyone,
exactly.
right?
I agree completely. I was just, and I know we just are wrapping up here, but I saw there's a woman named Dr.
Sure.
Cindy Gelner. She's at the University of Utah Health, and she's a pediatrician, and she was talking about how she sees so many patients with behavioral or mental health issues that she's starting to feel like a child psychiatrist, and that she really is able to, as a pediatrician, to address many mental health diagnoses, but there's just some that are just out of her scope, and then
Mm,
also she's not really trained as a counselor or therapist. And so she was just saying that it can be really tricky, for options for patients under age 18.
yeah.
Do you think, I mean, I know going in for your regular, doctor's appointment is really important. Do you think that there could be other options that we could provide? I mean, you've worked at a lot of different hospitals and clinics and locations. Have you ever seen anything that's just simple, that's like an easy way to kind of bridge that? I know we were talking about that too, about how to triage, with doctors and mental health care workers and other resources.
Yeah, so your question has a few different aspects to it.
Yep,
I
yep.
think Yeah. So I think it would be great for every pediatric office or organization that serves children in a coordinated way with different types of health providers. You come into an office and you're there at the receptionist, and then the receptionist hooks you up with a medical assistant, and the medical assistant then hands you off to the nurse, and the nurse then prepares the patient to see the doctor uh, in a lot of coordinated
Right.
healthcare systems.
Mm-hmm.
And each one of those places is a place where the receptionist could be trained in how to help somebody to calm down when they're feeling upset,
I love
or
that. Yeah.
feel safe, or be given a sense of welcome when they're coming in.
Right.
And they're often the ones who have to deal with the irate person who's upset for their own discomfort, or because they're late, or because the doctor's late, or whatever the
Oh, yeah. I mean,
case
I
may
even
be.
get doctors who call me because someone's suicidal in their waiting room, and they don't know what to do. And, and then the
So
person, like you're saying, at the front desk doesn't know. So, yeah, that's a great idea.
I think it would be critical. Yeah. So I think it would be a really great thing just to start, to be able to think about the roles for each person along the way as a person is being brought in to be seen, that each can have their own piece of the mental health empowerment part.
Yeah.
And to maybe initially help someone calm down and be in a safe place. The next person could potentially give them resources, or connect them with a counselor who might be there at any given time, or create an appointment that might be separate from the appointment that they're going to be going into to be seen by the doctor.
I think that's going to be
nurse.
I think that's going to be happening more and more too.
Yeah, I mean, I just think we can. It's how we create our systems of care, and if we can build mental health empowerment into the way that we triage people, we're gonna have a
Right, and then
more
it's like
stable
treatment approach. Well, also, I mean, it is. I mean, having a mental health issue like depression is just like having a cold. It's just you can't see it as easily. But I think we can work together, like you're saying, and help create a supportive environment that can really empower and care for the individual, and then that leads to understanding, including, and caring. And I guess I'm always imagining a world where we can share our feelings and our thoughts more freely, where we can move toward health for all human beings. And I know there's a lot of work to be done because, people needing mental health treatment and other treatments are not always receiving it. But I think if we each do our part to end these negative perceptions about mental health and raise awareness, we can live in a more loving, safe, and accepting world. Dr. Ben, I want to thank you so much for coming on the show. Do you have any final words of wisdom for our listeners? You had so much great information.
Well, thank you. I think about the STAR, staying safe, trying new things, always build up, respect yourself, others, and the environment.
Mm-hmm.
Those are rules that can be helpful wherever you are. And I think that when thinking through some of the things you were talking about at the end, with mindfulness, and how do you learn some of these skills, if it's possible to just look it up on the internet, go on YouTube, look up mindfulness, and see if maybe go through some of the exercises that someone might be leading in a mindfulness exercise, and then take this on and invite someone to do it with you.
Mm-hmm.
Because I think if it ends up being helpful for you, it's going to be helpful for someone else. And the more that we can reach out to others and find the space to help them learn techniques or tools, and see the world in a safer, more mindful place, we're going to be doing a big favor that will pay off when we actually have something traumatic that might happen to us. It might be the advantage that we need in order to get through the difficulties that inevitably happen to us every day.
Exactly. It's like a wave in the ocean. Well, it could help counteract that. So I think those are great suggestions. Yeah, check out that resource that Dr. Ben mentioned, I like that. I'm going to have to memorize the star. So, and I think also ways we can work together, like volunteering, checking in with ourselves, learning about other cultures. And then, I always really emphasize getting accurate information from like accurate, reliable sources, not random scientific studies that, you don't know who wrote it or where it's from. But I'm just always, imagining a world where we can move, toward that freedom. And so I want to thank you, my very special guest, Dr. Ben, for coming on today and sharing your wisdom. And if you have any questions, please write to me on my Facebook page. It's the Dr. Deborah Show. I also want to just quickly say thank you to HopeNet of Carpinteria. I'm on the board of HopeNet of Carpinteria. They're a group of concerned citizens who provide education and resources to prevent suicide. So our mission is to improve the mental wellness of our residents and to lessen the number of attempted and completed suicides in our community through information, support, training, and advocacy. So we're hoping to create a stronger safety net. And then if you or someone you know needs help, you can call locally here at the Santa Barbara Access Line. It's available 24 hours a day, 7 days a week. Their number is 1-888-868-1649, KCSB FM, Santa Barbara 91.9.